Welcome to this video series on Wellness Program Resources. Our topic for this video is Summary of Wellness Program Model Characteristics, number 51. One of my clients over the years was a large Eastern university, and I was meeting with the Director of Occupational Health and the Wellness Program Manager, and we were beginning to talk about what kind of a wellness program we should be designing for their some 34,000 employees. I could discern that fairly quickly that particularly he was coming from an occupational health background, not really understanding much about wellness, but obviously very much of an expert in occupational health and occupational medicine. They had assumed that, and I could read between the lines, that we were talking about, when we talked about wellness, it was really on a continuum where essentially all the items along the continuum would be equal in terms of their contribution and their impact on the health of their employees, which is not really true. I also had a sense that the strong occupational health background was paralleled with a weak understanding of some of the preventive aspects, preventive medical aspects, and preventive aspects of wellness. And the fitness orientation of their wellness program was, I think, driven primarily by the program manager who came from a heavy fitness background. And as we talked, I could tell that he didn't have the right perspective in terms of the three types of approaches to wellness. And those three are the feel-good model, which is a beginning point for any kind of wellness activity. And then the traditional wellness program, which is really more of a smorgasbord, use-at-will kind of approach with an expanded set of targets and behavioral targets, but not much in the way of compelling reasons for engaging in wellness. And then the third type of model is the model we call the results-driven model of wellness. And that's where we really get more serious about changing the health of the people that are using that program. So it was obvious that in our discussion that they were not clear about the implications of the three choices of models. We started down into the weeds, and I could tell that I was kind of losing the prime person, the Director of Occupational Health, as we were talking. So I suggested that I prepare a summary table of the main characteristics of the three major program models. And the next visit that I made to them, we ended up going through the document. And the tool that we worked on and refined is really begin to help both of them see the implications of the choice of what kind of program model or strategy they would essentially choose. Now, let's take a look at this tool and how you might use it to help clarify both your management's understanding and your wellness program's understanding of the implications of various choices that you could make in choosing a particular approach to wellness. As with the other videos, a link to this one-page tool is provided in the description for this video. I suggest that you pause the video, download the tool, and then restart the video and follow along as I cover some of the highlights. Now, let's take a look at the tool, and I'm going to use a laser point to be able to go over the tool with you. The program characteristics or features, the three models we mentioned, the feel-good model, the traditional model, and the results-driven model. And then these characteristics are kind of the key characteristics for these three models of doing wellness and organizing wellness for working populations. So the first one is a clinical risk factor orientation. You can see the weak, moderate, and strong. So this tells you immediately that as you move from one model to another, you actually are going to have a change in the emphasis of your programming. Next area is productivity emphasis, and you'll notice again the results-driven model tends to be more major in its orientation with productivity. The cultural change oriented again is stronger in the results-driven. The use of mandatory programming, and usually the only mandatory program that we usually suggest is a mandatory session where people find out why are they doing a wellness program and what are the key features of that wellness program. So that's got an orientation to it that's a little stronger. Also more of a systems orientation, and that's where we're looking at the various factors which affect a kind of a set or a range of behaviors in the work site setting. And so systems analysis usually wants to examine what are the key features, the precursors, the things which contribute to whatever change you're trying to introduce. Another one of the issues here is spousal and family orientation. Okay, again, higher in the results-driven model. Virtual versus site-based, and that's where we're dealing with how we offer services that are available to the individual on their own time or weekends and or family use of those services. Another one of the well-being emphasis can be strong in the feel-good wellness, but tends to be also strong in the results-driven area. Budgetary requirements are very limited in the feel-good, limited in the traditional, but much more modest and larger in the results-driven. The data-driven orientation, again, the degree of integration, again, you'll see many of these things are strong or heavy orientations in the results-driven area. The degree of integration required, the degree of generational segmentation and programming, the degree of organized development oriented, the evaluative activity, productivity, the economic orientation, again, stronger in the results driven. And economic return potential, much greater in the results driven wellness. Use of technology, use of benefit linkages, use of biometric screening, use of planned communications. And again, you'll notice the implications of the choices of these characteristics among the three models can help sort out the differences in what management and senior and also your wellness program leadership within the organization would have a concern for. There's also a use of biometric screening, the use of planned communications, the use of organizational infrastructure, the issues of technology infrastructure, the use of self-service technology, the use of coaching, the use of personal wellness objectives, use of incentives, and you'll notice again heavy use of those in the results-driven model. And then the use of medical self-care, consumer health education as collateral kinds of efforts that you can engage in your wellness program, the use of injury prevention, the use of group interventions, the use of commitment aids, the use of self-tests, and the use of open enrollment time periods and linkages, and the use of volunteers, and finally the use of value-based plan design techniques. So this again is a summary table of the characteristics that go along with the three models to help people get a much better and clearer idea of what are the implications of various choices. Now, as we go through the tool, you can ask some key questions. Does the senior wellness staff that you're working with clearly understand the three program models? And will this tool lead to a significantly clear organizational choice of a wellness program model in this particular organization or this particular situation? And do I fully understand the implications of the summary information in the tool? So it would take you some time to go through, think through what those implications are. And what's the best way to communicate this information to senior management? And then a few more tips about this particular tool and its use is you want to use the 3 program models or strategies to unify the organization's approach to employee wellness. And you want to keep reminding the people you're working with internally that these key players need to understand those implications. And then you want to talk about the situation that's a hybrid situation where you're not a clear archetype of the 3 models, but you are in fact offering hybrid opportunities, and also evolve those opportunities from year to year. So you may start with a feel-good model, you may move to a traditional for several years, and then you may end up with a results-driven model. So in summary, these are the various characteristics that we can associate with the 3 different major models that we can talk about. And we call them program strategies as well as models. And these can help you enormously in terms of getting the organization to have a consensus about the choice that you're making. And it makes it a lot easier for you to work with the group and the organization to help them improve what they're doing. In summary, a summary table of the major program models for employee wellness programs is a useful tool to help wellness leaders, the internal leaders, and the senior managers understand the implications of their choice. And thanks for watching this video. Be sure to subscribe to my YouTube channel. New videos are published weekly. And for more information, you can search for the WellCert program. WellCert is the premier professional certification for wellness program leaders. Be sure to check out this training program if you want to improve your wellness programming skills. And remember, delivering great employee wellness programs is a high calling. It's an important calling. And let's do our best to get the job done. Good luck with your wellness programming efforts.